What I'd like to do now is introduce Chris Lockwood, and he now tells me he's been ably assisted by Tom Lockwood. So Chris works for CBUS. He manages the industry partnerships and member health programs for CBUS. We heard Chris earlier because CBUS has a major sponsor for this conference, and CBUS also support us nationally. So CBUS was also the major sponsor for my charity lunch last year. So we're very grateful for the support, financial support that we get from CBUS. Chris's work to improve health outcome for CBUS members has a strong focus on supporting the delivery of evidence-based programs aimed at reducing the incidence of suicide in the construction industry. CBUS works with valued partners who deliver programs on site, face-to-face and online, supporting better mental health outcomes in the construction industry workplaces. Chris also chairs the Board of Permanent Care and Adoptive Families, a Victorian NGO providing essential education and support services to ensure better outcome for children and families in kinship care, permanent care and adoption. And Mark, who is with him, is also the project manager for Super Friend. Welcome to Tom and Chris.
Thanks for that, Michelle. Today, I wanted to talk a bit about a project that we're working on that's come through some insights from our field staff and also our call centres. Obviously, we've got a very broad presence across the construction industry nationally, and super's not the most exciting thing for a lot of people, but the reality of the industry actually does flow through into a lot of the work that we end up doing. And one of the key sort of elements that we've identified in terms of a risk for our members in terms of their mental health comes around job loss. As an industry, I think most people in this room would probably know, if they know the construction industry, that an inherent part of the way employment works in the construction industry talks about periods without work, the experience of redundancy on a sort of regular basis. This short-term work is on the increase, and the casualisation that actually flows through in other industries more hardly felt sometimes in the construction industry. Job stability is a pretty fundamental thing for anyone, but particularly men have a greater experience of the tensions and stresses around the impacts of poor job stability. So we know that those particular risk factors do have an impact on members' mental health and their future prospects, which is why we decided to take stock and think, is there something we can actually do in this space? We, as an organisation, we're solely focused on our members' best interests. That's the only reason CBUS actually exists, is for the best interests of our members. We're set up by the industry. But we also know that member wellbeing is also about a healthier workforce, better for the industry overall. And we've had a focus since about 2006 in terms of trying to introduce programs or support programs that are actually going to deliver the best outcomes for our members across the industry. In terms of what we could actually do in this space, we had to think, what is it that we can actually realistically do as a super fund for the members who are actually experiencing or anticipating job loss or redundancy. And we realised that we were in a strong position to connect with members experiencing job loss in our industry, as we can actually see a potential proxy for job loss in our data. When superannuation payments stop, one of the main reasons they're going to stop is because people actually aren't in work anymore. And given that we've got over 400,000 active members nationally, we had to think, what could we actually effectively do that we could roll out nationally? And we decided to partner with Super Friend, which is why Tom's joining me today to speak about the initiative that we're actually working on at the moment. And Super Friend, like Mates in Construction and IncoLink and AusHelp and other organisations around the country, are aimed at supporting better mental health outcomes for our industry. So that partnership has developed a pilot program that we're going to talk about today, and that draws on an evidence-based approach that is informed by the lived experience of our members, both on site and in offices around the country. And my colleague Tom Notley from Super Friend has been managing the project and will take you through some more of the detail of the project. So, Tom.
Thanks, Chris. So Super Friend consulted with CBUS on the idea they had where they wanted to support members who are going through job loss or redundancy. So through the consultation, we decided to create something of a communications plan, essentially, where we knew that we wanted to provide education and awareness around the importance to members to look after their mental health and positively look after their mental health and well-being when they may be going through redundancy and they may be out of work. So we landed on developing a pilot, and the pilot looked like it was an 8-week program where a member would register for Reconnect, and Reconnect was the name of the program. And via their email, over 8 weeks, we would provide them with a number of resources and articles that spoke to particular topics around managing their mental health and well-being if they're out of work. Now, to make sure that the information we were presenting and we were promoting had a basis of evidence behind it. There you go. To make sure that the information we had was evidence-based, we had the Australian Psychological Society complete a literature review of all research published around mental health, redundancy and the construction industry, and we used this to help inform the way we actually developed the information we were trying to promote to the member base. So we knew that we wanted to have some clear messaging within the articles and the resources, so we made them themed around particular topics. And we also wanted the information we promoted to have a practical element to it, so we could actually encourage people to do something in their day-to-day lives that might actually have an impact. And we also made sure that through all of the information we provided, that there was information and referral to other community support organisations where people might need to speak out or speak to somebody. We provided the referral services for that, and that included some of CBUS's other partners through Mates in Construction and IncoLink and OzHelp, who are delivering services on the ground level. And during the promotion of Reconnect, CBUS actually went through a program where they looked at their data that they received from members to try and understand who might actually be going through a period of job loss and redundancy, and that way they were able to promote the program to people that might actually benefit of it at that time. So this is just a few examples of the promotion of the program. On the left we've got CBUS News, which was a paper article that goes out in member statements. We promoted it in the CBUS website, and we also had a social media campaign through Facebook. So we completed the pilot, so an 8-week program had been completed where people receive a weekly information around certain topics. And it was very important for us and for CBUS to understand from the people that actually went through the program what their experiences were, so that we could take that information and inform any future programs we might deliver. So we conducted a number of focus groups with the people that went through Reconnect, and we found out from them what they thought worked well, what they thought didn't work quite so well, and what their recommendations might be for any other program we might create. And this was extremely important for us to make sure that what we deliver is based on the needs of the members who are going through job loss and redundancy. And we had a number of key learnings, and we had a number of recommendations. So for example, we learned that the expectation of Reconnect from the member was a little bit different to what we had intended. So the program was always intended to provide awareness and education and kind of practical tools and supports that people can do day to day around different topics of managing their mental health and well-being when they're out of work. Now, some of that included tips and advice for seeking and searching for work, but a lot of members thought that the program might actually deliver a job at the end of the 8 weeks, which wasn't the intention of the program. So the actual messaging and the expectations was a little bit disconnected, and we learned that through the focus groups. We also learned that the most engaged member were older workers. We found that the older workers resonated more with the content, that it spoke more to what their needs were, and they found it more beneficial. With the younger worker, we found that a lot of information they were in some ways already performing or on top of, and it wasn't quite so relevant. We also found that the member needs were quite specific, and it was quite widely reported that the participants found there was an opportunity with Reconnect to create more interaction between the member and CBUS, as well as interaction and connectedness between each other going through the program. So more of a peer support type of approach where they could actually bounce ideas off each other, learn from each other's experiences. And we also learned that the way we delivered the program out to members was very widely well received, which was great, but some of the messaging of each week was a little bit confused. Sometimes we could repeat some messaging from one week to the next, so it wasn't quite as clear as we would have hoped. But we learned that the most popular topics that we promoted were all around finding work, managing stress and living on reduced budgets and finances, which weren't really of a surprise to us at the time. So the people that went through Reconnect had a number of recommendations, and they recommended that the support be provided be a bit more tailored potentially, and that we consider integrating more social connections between people going through the programme. So they recommended that a lot of people wanted to get information that was particularly important to them at that time. So instead of waiting for a particular week to talk about a particular topic, they wanted to be able to have the flexibility to get what they wanted at that time. They also recommended the consideration of peer support, so a way that they can connect with each other. They also recommended that the activities that we would recommend people to do during the articles, and some articles were developed to create information and education and awareness, other articles were developed to create more of a call to action where we would suggest things for people to do in their day-to-day lives. They thought that area could be beefed up a little bit. And in the actual delivery of the programme, they recommended that the messaging of the topics be a little bit clearer and not quite so repeated for each week. So we tried to take that into consideration too. And knowing that the older worker was the people that engaged most with Reconnect, we decided to move with that for any next rounds. And we asked the Australian Psychological Society to do another literature review of what are the needs of the older worker within the construction industry who may be out of work in terms of managing their mental health. So following the focus groups, we took that information, we decided to make some changes to another pilot that we would run. So we focused this time round on more of an older worker cohort of people. We also tried to kind of streamline the messaging that we were delivering in the programme, and we also made some changes to the way the programme was delivered. And what we didn't do consciously is we didn't create the peer support that was suggested through the focus groups. Whilst we acknowledged that this would be a great engagement piece and would provide an awful lot of social connections of shared experiences, the scope of the pilot didn't really allow for that at that time, but it was certainly something that we were considering with CBUS for any kind of future programs we might run. So the APS recommended just some changes to the language that we use, so we tried to make sure that the actual language in the program was a little bit more personable, to engage with the older worker a little bit more, to try and normalise the journey of being out of work, and to make the recommendations and the actions that we are trying to promote that they could do a little bit more digestible, a little bit more relatable to their day-to-day lives. So we tried to tweak the actual language we used. We also streamlined the content, so we decided to eliminate any kind of repetition of content, and we grouped all of the articles into particular topics. So one week would be all around the importance of self-care, the next week would be all around the strategies to help find work, social connections, and we had 6 main categories that we decided to group all of the information into. And we then decided to make a few changes to the delivery. So we actually took a lot of information that was in education resources and condensed all of that information into the actual body of the email that people would receive every week. So the email itself became part of the programme, where we would provide some information, some awareness, we'd provide links to other organisations and supports, and suggestions of things that people can do. We also went straight out with offering information to support people to get information and support around finding work, because that was the most popular article, so we decided to give people what they wanted straight away. And we then decided to try and simplify the experience that the members had when going through the programme. So we developed a portal on the CBUS webpage where we allowed the participants to actually download and review every article that was available. So we gave them the flexibility to get what they wanted at that time. So within Reconnect, we were very limited to understand what the circumstances of the people who registered for the programme were. We didn't know how long they were out of work. We didn't know what their personal circumstances were or what they were facing in their lives at that time. So we wanted to give them the flexibility to look at information that was relevant to them, but it also allowed us to actually push and promote articles that we knew the APS literature review said that people may not necessarily see the value or actively seek support in certain areas. So we allowed them to go with what they wanted, but we also knew that it allowed us through the 8-week programme to nudge and to suggest particular topics that the research said was actually vitally important to holistically managing mental health when somebody's out of work. We also added a mid-programme check, so we actually invited members to connect with CBUS through telephone or email to discuss their experiences, to talk about how they were going and to seek support. So we tried to add a little bit of connection between the people participating. And here's just a quick example of some of the articles. This is one of the emails that would have gone out to the members on a week. So week 1 is an introduction, week 2 was all around finding work. So we provide a little bit of information. The blue areas we link into articles around job search websites, apps that are specific to the construction industry, and a to-do list on the right-hand side. And this is just a quick example of one of the introduction information articles all around dealing with stress, where we provide information on the left and actions that people can do at the end. I'll just hand back to Chris to talk about reconnecting in the future.
I'm mindful that there's only a few minutes left before lunch, and I don't want to hold people away from the important things in life. But for us, in terms of taking the program forward, making it available in real time is going to be a bit of a priority for us, using technology to move away from a sort of manual delivered to an automated functionality. But specifically, a key for us is going to be how we actually work with employers, unions, the associations of our industry to promote Reconnect as a support program for members at need, because we're seeing this as becoming part of just a BAU aspect of how CBUS can actually support our members at different times through their working lives. We are considering creating a facility for members to connect with each other when they're experiencing job loss, but there's practical limitations to that. There's a fund that we are working through. And we're looking to consider Reconnect content to support members unable to work due to illness and seeking benefit from their superannuation insurance. So there's work to be done with our insurance team specifically to support people at those times. And we obviously are looking to share our learnings with industry partners and leverage their knowledge and experience to improve the program and efficacy. And we know that part of the reason of to do this work with Superfriend works across all industry super funds. So there's other industries that they work with. So this is aimed specifically at the construction industry, but there's opportunity for the learnings of this to be taken to a much broader audience, which is why this pilot's been run on a small scale, but there is opportunity for it to go beyond the construction industry through Superfriend. And the program learnings, particularly the impacts on older workers, are informing the broader approach that CBUS actually takes to how we support our members approaching retirement, because a lot of workers in this industry, they don't actually retire, they're forced into early retirement through to illness or the body's not working in effect. And so understanding those issues facing our members, we're able to draw some of those learnings into broader policies that we actually have to support our workers. We know we can't fix or stop job loss, but the purpose of the Reconnect program is to just build a little level of engagement for people at times of need that hopefully can provide some benefit in terms of what can be one of the most stressful times that people face in their working lives. Thanks.